So I literally have now gone through 2 broken arms with my kids, but a lot of scares. And I feel like I'm always calling you to ask you, what do I do? Do I go?
It's tricky. Little kids injure themselves a lot.
Yeah.
Witnessed, unwitnessed, it makes it harder. They're not great historians, so they can't always tell you. One of those things that's really hard to tell the difference between a broken bone and like a bone bruise or a sprain.
I'm so scared of getting hurt.
12 to 24 months.
Oh my gosh, no. I can't go that long without playing tennis.
It takes avocado ham. It is very real,
Okay.
and it's actually pretty terrible. I've never met anyone who's willing to say, oh, great, 24 months from now, I'll just get back. So there are things that you can do.
What do I do?
You're a doctor, right? Take 3.
I'm Dr. Sonya Bhole. I'm a breast radiologist, and you're listening to You're a Doctor, Right? The podcast that answers all of your most common burning medical questions. I'm here today with Dr. Skjong, one of our dear friends who happens to be a board-certified orthopedic surgeon who specializes in hands. So thank you for being here.
Oh, thank you for having me. It's wonderful.
Christian and I met basically the first day I met Silas, my husband. So if you haven't listened to the episode with Silas on anesthesia, make sure you go check that out. But I met basically Christian and his wife Brooke the same day. The rest is history. We've been forever together ever since.
That's true.
Moved from the city, 2 places, an apartment to a house, and then finally to our forever home in the northern suburbs of Chicago.
Phase 3, Sonya.
Phase 3.
Following each other.
So we've been doing it together ever since, and I just feel so grateful.
Fun to be here. Thank you.
Of course. Well, as you know, the premise of this show is basically questions that people have at cocktail parties. So they come up and say, you're a doctor, right? And they have so many questions. I'm so lucky because you are basically our personal concierge orthopedic surgeon. So I call you up all the time with these boys that I have and say, you're an orthopedic surgeon, right? What do I do with this? So I'd love to maybe open it up and ask you what the most common question you get up here at cocktail parties. I know the questions that I always ask you, so I definitely want to pivot to that at some point. Before we get started on our episode today, I want to remind all listeners that the content of this podcast is for informational purposes only and does not constitute formal medical advice. Do not delay in seeking professional medical care because of something that you have heard in this podcast. If you have any questions regarding your own health, please talk personally to a doctor or other healthcare professionals. Relying solely on the information provided in this podcast should be done so at your own risk. Now that we're done with the paperwork, let's get started on this episode today. But what are the questions that you get?
They're probably similar to the questions that you ask me.
Yeah.
And it's usually like a couple things. You could probably get to both of them if you wanted to. We get asked a lot about tennis elbow up around here. A lot of folks play pickle and paddle and tennis and things. So tennis elbow is a hot topic. The other most common thing is when it comes to little kids, like when should I take, how do I know that there's an injury? When should I take them to the doctor to get it checked out?
Yes.
Which is actually really hard to kind of know. But those are probably the 2 most common things that I'll get asked all the time.
Okay. And those are basically the 2 most common things I always ask you. So I think it's great. Should we start with what the kid one? Because I always ask you that. Okay.
Yeah.
So I literally have now gone through 2 broken arms with my kids, but a lot of scares. And I feel like I'm always calling you to ask you, what do I do? Do I go? What do I do? So if someone doesn't have you on speed dial, when do they know if they should go to the doctor or not?
That's a great question. And I think we take a lot for granted knowing what we know because it's like a huge boon for us to be like, oh, don't worry about it or worry about this.
Yes.
But we know that because of what we do. So for the folks who don't have access to that, it's really tricky. And it's really tricky because kids, as you are very well aware, play a lot and play really hard and aren't afraid to do most crazy things that make us nervous nowadays.
Yes.
And it's tricky. Little kids injure themselves a lot.
Yeah.
Witnessed, unwitnessed, it makes it harder. They're not great historians, so they can't always tell you, hey, mom, dad, I fell over here and my elbow hurts, or this is where it hurts.
Right.
Out of the corner of your eye, you'll just catch them not using their arm or walking with a little limp. And that's always kind of like the red flag, something happened.
Right.
It's one of those things that's really hard to tell the difference between a broken bone and like a bone bruise or a sprain in a younger person. And a lot of it just circles around our skeleton and how we grow. Little kids have growth plates in their bones, funny little spaces you'll see on x-rays where we get taller and bigger.
Okay.
Very cool. They grow a ton. They make us heal really, really well, but they're really soft. Okay. So it's easy to kind of injure those and either just have a bone bruise or a broken bone.
Yeah.
And the treatment can be very, very different.
And I remember this from medical school and, from being a radiology resident, that it makes a difference. You don't want that fracture going through a Bro's plate and missing that, right? We want to know that because that can actually inhibit growth in that bone, right? Is that okay?
If you miss something, it can cause a lot of problems for your child down the line. So it all kind of boils down to like those red flag signs. Like we, as parents, we know our children the best. We know how they behave and how they walk and what they do normally. So any kind of deviation from that you see, if they're not using their arm, for example,
something that's not normal for them.
Not normal. Yep. Little kids will either kind of like tuck it in next to their side because it hurts to swing it when they walk, or you'll see them just kind of dangling the arm around. Or if they're really little, they won't be crawling and using their arm. So any of those things, any outward signs of swelling or redness or anything scary like that, it's probably better just to go and get it checked out.
On the side of being cautious.
Yeah.
Yeah, because I remember, like you said, witness or unwitness, I feel like I'm a helicopter mom. And my son, Christian, side note, our son, Christian, has the same name as you. You're just such a wonderful person. And I remember Silas called you from the hospital and said, "Are you okay if we name our son after you?"
I remember that. I remember exactly where I was.
You, but it's so nice, like, to have the same names because, we went through so many names. I remember that person was mean in elementary school, or you associate with that name, but obviously we associate you.
Oh, it's an honor to share a name with him. He's a lovely little dude.
Yeah, so I love that. But okay, I digress. But going back, I remember when Christian was on a bounce house. We were all standing there, but we just didn't see the injury happen.
Yep.
And it was a couple hours later, and he was like complaining about arm pain, and I called you, and then a couple hours later, he had a little effusion, so we knew something had happened. And you said, just err on the side of being cautious, like just make sure, because we want to make sure there's nothing there.
Right. I mean, you go and get it checked out. A little x-ray will tell you what's going on. Worst case scenario, you are treating them appropriately and early.
Right.
Best case scenario is that they have like a bruise and you just have peace of mind that it's nothing scarier in the moment.
And I remember also it can be very normal that actually the x-ray doesn't show something. Because I remember kids when I was doing my pediatric rotation for radiology residency, I remember they would come back a week later and all of a sudden you could see a fracture that wasn't there.
Yep. It's all about the growth plates. And that's where some of your listeners might have had that happen, where they'll have a child go and the physician will kind of treat it like a break, even if they can't see it on x-ray. Because a lot of times it's that soft little growth plate, it gets dinged up. You just treat them for a few weeks in a brace or a cast or something. And then if you do get a second set of x-rays, you can actually see the healing bone, which just kind of corroborates that you were doing the right thing for it. But
okay. So being careful.
Yep.
All right. So I want to pivot to what you said earlier, because I also always call you. I'm a tennis player. I go to tennis camp every year, a grown-up tennis camp.
Yeah.
And I always come back with a tennis elbow. So
Dreaded
what is
tennis elbow?
How do we know we have it? How do you prevent it? How do you treat it?
It's a great question.
Scoop?
Great question.
Okay.
Super common, ridiculously common.
Okay.
It's named after tennis. It often doesn't have anything to do with tennis in a lot of people.
Okay.
But racket sports are notorious for causing it. And it's a weird disconnect. Think of it like a tendonitis, like inflammation around the tendons and the soft tissues. It's built around our extensors. So everything that extends your fingers or your wrist comes up, attaches to muscle in your forearm, and then turns into one bigger tendon that attaches on the little bony bump we have on the outside of our elbow.
Feel that bump. Yep.
Yep. So with racket sports in particular, it's a lot of gripping, a lot of, hitting objects and things that kind of puts just a ton of stress. And if that gets inflamed and irritated, it's actually really, really uncomfortable and painful.
Yes. And it takes a long time to heal, right?
It takes a long time.
Okay.
Long time. So the weird thing with tennis elbow, if you didn't treat it at all and you didn't do anything, you just ignored it.
Yep.
It will go away on its own. It's like a strange self-limited thing.
Okay.
It can take 12 to 24 months.
Oh my gosh. No, I can't go that long without playing tennis.
It takes forever.
I also know it is my stress reliever. Okay.
So I've never met anyone who's willing to say, great, 24 months from now, I'll just get back to tennis.
Right.
So there are things that you can do both from like a preventative and a treatment. The biggest thing, which is hard, none of us do it, or most of us don't do it. We should like warm up, focus on warming up.
Yeah.
And like preparing for the season and things, especially with like paddle, winter sport. People don't usually play it during summer, fall, end of fall, winter hits, and everybody goes hard and plays a million matches all the time.
That's what I do. I'm like, okay, I've worked all day. Let's get out there and play.
Get out there, man. Going cold.
Yeah.
So the most important thing is like prepare for that.
Okay.
before the season starts, like try to go out and play a few matches.
Okay.
Just try to warm up a little bit before you really go hard.
Okay.
And then the most important thing, actually, which again is really hard for most of us, is to try and like stretch before we play.
What are the stretches I should be doing?
So there's one.
I don't stretch.
That's okay. It's okay. No,
but I will now.
No harm, no foul. I was gonna say, there you
Okay.
go. But build it in. So they're actually called inertial stretches.
Okay.
It's not important what they're called, but they're funny little stretches where you try to keep your elbow as straight as you can.
Okay.
And then you pull your wrist back and kind of hold it there for 10, 20 seconds.
Okay.
And then flex your wrist down and hold it there for 10 or 20.
Okay.
You're basically just trying to
feel
stretch and like loosen up the forearm muscles. It's kind of like doing a runner's stretch, or when, you stretch out your calf or your hamstring or something before you go for a run, which I also never do. But for the arm, it's good to kind of stretch it out and just kind of warm up before those matches.
Okay. Yeah, this is my first season with paddle, and like within the first week, I heard of retinal detachment and ankle injuries and Achilles tendon rupture. So I'm like out there with braces and goggles. I don't look cool at all. But I'm so scared of getting hurt. So I guess the same goes for lower extremities too. Just making sure we're stretching everything before bracing as we can.
Yeah, racket sports, a lot of lateral movements. So it's different than like going out for a run. Straight line running is one thing, but the minute you start to kind of like cut or pivot or go sideways, it puts a ton of stress on your knees and your ankles. So trying to stretch, wear appropriate shoes.
Yeah.
Paddle tennis is played, on a different surface than like normal tennis or pickleball.
Yeah.
It's usually a little bit grippier. So if you're not wearing the right shoes, or if you're kind of dragging your feet, it's easy to twist an ankle or twist your knee.
Yeah. Okay. And I remember, this is really random, but I remember when I had tennis elbow once, you kind of mentioned a wrist brace.
Yeah.
Can you talk to me about that? Because I was like, did you hear me? It was my elbow. And you're like, wear a wrist brace.
No, that's perfect. It's a good thing to bring up. So from a treatment standpoint, there is like a bracing component to things.
Okay.
Two main categories. The wrist brace is actually anecdotally a really good treatment for tennis elbow. It sounds very strange because we tell people, wear a wrist brace when you sleep. Usually we'll have people do it when they sleep. And people always raise their eyebrow because they're kind of like, my elbow hurts, not my wrist.
Yeah.
But because of how everything's connected and because of how we curl up when we sleep, we tend to kind of do that, and it tensions the tendons that attach to your elbow. So if you can get a cheap pharmacy, online wrist brace, as long as it has that harder piece in it that won't let you flex, it offloads all those tendons and lets them rest all night long. So that's actually a really good thing to wear. The other alternative to that is something called a counterforce brace.
Okay.
You've probably seen people wear them. They're like the little bands,
right? Okay.
Yep. Very, very common. Some people love them. Some people do not like those all that much. If you have really bad tennis elbow and that area is really painful, those braces are designed to kind of squeeze down on you and offload the attachment
a little bit. Okay.
It often hurts to wear it. So some people swear by them.
Okay.
And if it works for you, worth its weight in gold. But if not, the wrist brace isn't actually that's a really good alternative for it.
Okay. So similarly, related, but not the same sport, but golfer's elbow.
Yeah.
That's more in the inner, right?
It is.
Okay.
It is. Think of it exactly the same from like a tendonitis kind of tendon kind of a thing. It's just a totally separate subset. It's all the flexors, so everything that lets you grip or flex your wrist. Those come up and attach on the little bump on the inside of your elbow.
Okay.
So just a different mechanism. Swinging a golf club, there's a lot of like kickback as you hit the ball or if you hit a big divot. So it kind of kicks your wrist in a different way. So the treatments are almost exactly the same for that.
Same stretches?
Same stretches, yep. Same bracing if you wanted to. The only difference with golf is that it involves a lot of trunk rotation, like repetitive trunk things. So in addition to the upper extremity problems that we'll see, we see a lot of folks with like muscular back, abdominal problems. So similarly, if you're going to golf, like do your stretches. If you're on the first tee, just take a few seconds and warm up. Take a few practice swings, do a lot of like trunk rotation stuff. Just try to warm things up.
Okay. Well, I'm not a golfer, but you know what? I'm thinking about picking it up this summer. So you're going to see me out there just stretching along.
We can be terrible together.
Yeah,
it'll be lovely.
We should do that together.
That'd be super fun.
Let's take a golf lesson. Okay. So one more weird pivot. You didn't mention this, but I feel like I'm so curious about this because I've gotten so many text messages, and I'm going to keep you suspenseful about, is this real? But that is the avocado hand. So as
avocado
a
hand
hand surgeon, is this real? Is there such thing as an avocado hand?
It is.
What is it?
It is very real, and it's actually pretty terrible. It's a pretty bad injury to have. So avocado hand refers to a cut or a laceration. We make it sound fancy. Of your flexor tendons in your fingers. So traditionally we are in a rush.
Yes.
People love avocados.
Yes.
It's like the classic, like post paddle, post golf,
Yes.
like go to brunch,
Yes.
get your avocado toast,
Well,
go
that's what
home.
made me think of it. I was thinking about playing tennis and then brunch.
So
yeah.
we traditionally rush. You grab a sharp knife, you
Yep.
slice through the avocado, it hits
And
the
you
pits.
hold it like this. Yes.
Which makes no sense when you
Yes.
actually think about it, but we hold it in our hand.
Yes.
The knife will slide off the pit and it will cut your hand,
Yes.
which is really hard to repair. It's really hard to recover from a tendon laceration like that.
Yeah.
So simple stuff. And all it takes is like 10 seconds just to be like, you know what? A sharp knife coming at my hand is probably not a great,
Yeah.
this
And
probably isn't a great thing.
I always grab the sharpest knife, but I could literally use a butter knife.
You could
Or
literally,
a cheese knife. I mean,
agreed,
really.
like the dullest
spoon.
spoon. I mean, anything will do it, a butter knife.
Yeah.
And you kind of preferably like put the avocado down on like a cutting board or something and then cut around it that way versus holding it in your hand.
So it's real.
It's definitely real.
Okay.
And it's bad. So the next time you make avocado toast, just
put it on a
chill
cutting
for a few
board
seconds. Yeah.
and get, I don't know how to chill, Christian. You know this.
What? You?
Okay. Well, this is really, really helpful. I feel
Good.
like I have like a million other questions I could ask, but we should probably save that for another episode. So
Sounds
I just
good.
want to really quickly recap.
Yep.
Kind of bounced around, but hit a lot of hot topics, things that we're hearing in cocktail parties. So I'm so glad we touched on them.
Yeah.
So children, broken bones, really hard to tell the difference between a broken bone or a sprain sometimes.
Yep.
Worried about gross plate injury. So if your child is persistently, they're bad historians. So if they are persistently not using something or something that's off from their norm, we know as parents, just get it checked out. Make sure. Sometimes the doctor might treat it as a broken bone or might not, but then you come back a week later and you can actually see the injury. That can be very common. It's probably happened to a lot of our listeners, as you said.
For sure.
So really, really normal, but just make sure that you're just erring on the side of being cautious. If you don't have your number on speed dial, like I'm so lucky to have, just make sure you're getting it checked out if your child has
Safety
symptoms.
first on that one. Yeah.
Safety first. Paddle, golf, tennis, racket sport, pickle injuries. Really common. You see them all the time. Make sure we're stretching beforehand. Braces are okay. It's okay not to look cool on those courts.
It's totally fine.
Goggles, braces,
we're too old
everything.
For that. We're too old to look cool
old.
with this.
Make sure you're stretching. Don't just go out there and be a weekend warrior.
Yep.
Make sure you're stretching and warming your body up. Trunk stretches for golfers.
Yeah.
And then finally, avocado hand is real.
Super
so
real.
Just
super bad, super real.
Take that avocado and put it on a cutting board and use a blunt knife.
For sure.
Okay, well, thank you so much for being here on this Sunday morning.
You're welcome.
I appreciate it. That was really fun. I learned a lot.
It was. Thank you for having me. This is great.
All right, thanks.